it means you're either ovulating or menstruating right now.
You're right on the money.
Wow, you have a very low heart rate.
Yes. So when I was born, I had an atrial septal defect. Do you see my scar?
Mm-hmm.
Yeah, I had open heart surgery to have it repaired. And so I have POTS. I do have leaky gut.
Okay, so you diagnosed with your self-diagnosed leaky gut. Are you self-treating your leaky gut?
No, I don't know how.
Okay, so that's good. That's wonderful. Anything other extra spinal, feet, knees, ankles?
Something weird it's happened to me twice, and I've been meaning to contact my doctor about it, but when I travel, I've noticed that like my ankles are swelling a little bit, and I'm my feet are swelling a little bit too. I don't know if it's like actual swelling or if it's like fluid. I'm not sure what it is, and it might be a coincidence that it's happening while I'm traveling. But it seems to be a common denominator every time it happens.
Okay.
I'm not sure what's going on with that.
Okay, it's not associated with your period?
No.
You ever have your thyroid checked? Let me see your nails.
I have like a long time ago.
Was okay then?
Yeah. Yeah, it was fine.
Okay. You tired at all?
The older I get, the more fatigue I experience, but I think that's kind of normal, I guess,
Kind of
with age.
Slow decline fatigue, not like
Yeah.
all of a sudden you're just like wiped out.
Right, yeah.
Okay. Any digestive changes go along with that?
No, I'm doing pretty good in that
Is it just
area.
a traveling because you're eating bad?
It could be because I don't eat fast food a lot, and whenever I do eat fast food, it throws me off.
Okay, sodium. Okay. When you had COVID, did you have like lung symptoms, breathing? Did you get that whole thing? Pressure in your chest?
The first time I did. The last 3 times I didn't really. But does my blood pressure seem low? Or
No.
what were you checking for?
Couple things. Okay. Did I tell you this last time? Okay, hold on. Because this is an Ayurvedic pulse reading. Okay, there's 3. So in Western medicine, they use a pulse reading to measure. They should be measuring rate, rhythm, contour, and amplitude. It's how every medical doctor and nurse, chiropractor, any primary healthcare physician, they learn that. But no one uses any of that except for rate. 60 beats per minute. It's all anyone ever does. Is yours on the slower side?
Yes.
Yeah, sure, absolutely. What is it? Hold on.
It's got to be.
Hold on. Yeah. Actually, that was. So I did a 15-second reading, so it would have been just a little bit more than 60, but it's pretty much almost perfectly on time, just a little tad slower than 1 per second.
Usually it's low, and that's just another symptom of POTS. Yeah.
But, so you've had the POTS your whole life. All right. Well, the cardiovascular system's on the other side. So the contour is like how the pulse feels. And they don't use it in Western medicine anymore, but they used to. So in Eastern medicine, and Ayurveda and Chinese medicine, they feel for the 3 different characteristics of the pulse. And so there's 3 fingers, 1, 2, 3, and then there's a superficial and a deep. and each spot uses or connects to an organ system.
Okay.
So it's small intestine, stomach, and adrenal gland, thyroid. And then it's, when you go to the deeper layer, it's lung, spleen, and the organs of reproduction.
Wow.
So, and then, the cardiac, I gotta go to the other side for the other stuff. But on this side, the first time I felt it was, there was just one very distinct pulse at your lung. Okay, which is why I asked that question. But your reproductive system is very strong. It's like kind of overtaking the rest of it. So it means you're either ovulating or menstruating right now.
You're right on the money. You're correct.
So it makes it harder to read, which is, why they say, it's why when back in the day, you ever read the book The Red Tent? Anyway, there's all this stuff about like many ancient cultures, like all the women used to bleed together because women menstruate together, it's they synchronize.
Yeah.
And then they used to have like an extra village built, and the women would just go to the extra village. They would all bleed together. Because you're not supposed to.
Oh, that's so funny.
Yeah. So, all right. So I'm gonna do some lung stuff. And then we'll see. We'll dig in underneath of the cardiac floor as well, and really do some diaphragm work down there. So, but they did. You're a zipper club, right? Can you tell me that?
Yep.
But didn't they fix it though?
Yeah.
So why do you still have POTS? Is the question.
I don't know. Yeah, I'm in a Facebook group that's called like whatever, something POTS, and a lot of people have had the open heart surgery, had it repaired, had the surgery was successful for them, and they're still having issues with POTS. And so I don't know.
Well, it's probably just like scar tissue on the outside of the heart, because they have to open your heart, right?
Yeah.
So maybe scar tissue on the outside of the heart, and then there's just like a slight delay.
And so my heart was actually enlarged also because of the ASD. And so I don't know if that might have something to do
Sure,
with it.
absolutely. That's enough explanation right there. Your heart's like, it's like floppy. You know what I mean? Just, the blood's just squishing around in there.
Yeah.
So when you go to change positions and then the demand increases, your heart needs just like an extra second to catch up. You can still live to like 110 with that, though.
Huh?
You can still live to like 110 with that. Like, it doesn't make any difference on your longevity.
No. Yeah.
Okay, breathe into your belly here. Okay, breathe into your belly. Okay, try to lift your belly as you breathe in. There you go, just like that. Uncomfortable?
Yeah.
What does it feel like?
Pain.
What kind of pain? Is it my skin? Is it your skin? Am I pulling your skin?
No, just I think like your fingertips, like the pressure.
Yeah. What about when I pull it down? Is that still painful?
Yeah. Yeah. And I actually feel that when you pull down,
Yeah.
I feel it like kind of down in here too.
All right, cool. Because this is where all the noise is coming from. Your splenic flexure, all that stuff is all right here.
Okay.
So this is where your colon.
Yeah, I actually will feel movement in there when my stomach is talking.
You might just have scar tissue, like how the intestines attach to the body wall. Put this arm up here. Okay, make this strong. Don't let me push it. Okay, then relax. Okay, deep belly breath here. Actually, put that away. Good, deep belly breath. Okay, deep belly breath. Okay, deep breath. Good, deep breath. Deep breath. Deep breath. Okay, deep breath. Push your ribs out against my hands. Out. Do it again. Out. Do it again. Alright, I'm gonna see here. Take your hands and then just up your breasts and then like move them out to the side because I'm gonna work on your sternum in the middle here.
Okay.
Okay, deep breath into your belly. All right, now put both your hands in the middle of your chest there. Okay, deep breath in, out. Good, deep breath in, out, in, out, in, out, in, out. One more, in. Tender there?
Yeah. Right in here. Pretty tender.
Okay, make it strong, don't let me push. Let's try this one. It's the opposite. Okay, hold this up. Make it strong. Okay, it's good, let it relax. Okay, hold this up again. Make it strong. Okay. Pressure's good? Pressure's okay?
Yeah.
Nice, gentle breathing.